today I'm going to talk about STDs. What are STDs? STDs are sexually transmitted diseases. STDs are infections that are spread from one person to another, usually during vaginal, anal, and oral sex. Some STDs are carried in semen, vaginal fluid, and blood. Others can also be passed from genital to skin contact. They are common, and most people who have the disease do not always show any symptoms. Without treatment, STDs can lead to serious health problems such as infertility and cancer. There are dozens of STDs, and some of them include chlamydia. Chlamydia is a common STD that is caused by bacterial infection, often does not have any symptoms but easy to treat once it is diagnosed. We also have genital warts under STD, where there is a growth on the genital area and around the anus, and this is caused by certain types of HPV. There is also gonorrhea. That is also another type of STD, and it is caused by bacterial infection. It is often does not have symptoms but easy to treat once it is diagnosed. And there is also hepatitis B. Hepatitis B is a virus that can cause the liver disease, which is spread through sex by sharing personal hygiene items like razors and brushes. There is also herpes under STD. Is also a common type of STD that infects the mouth and or genitals, and this is caused by bristly sores. There is no cure, but symptoms are treatable. There is also HIV and AIDS. HIV is an infection that breaks down a person's immune system and can lead to AIDS. There is no cure, but treatment can help a person with HIV and AIDS to stay healthy throughout his or her life. We have HPV under STDs too. HPV is a human papillovirus. It's a common STD, and it is usually harmless and goes away by itself, but some types can lead to cancer. There is also another type of STD, which is molluscum contagiosum. This is an infection that causes small bumps on a person's skin, and it goes away by itself, and it's usually not dangerous. Then there is one type, which is scabies. Scabies are tiny parasites that cause itching and pass through skin to skin contact, usually through during sex, and can also be cured. And there is also syphilis. Syphilis is a common STD and caused by bacterial infection. It is easily cured with medicine, but it can be dangerous if it is not treated. The last one on the list for STDs is trichomoniasis. Trichomoniasis is a major cause of vaginitis, but it is very common and it is usually treated. So these are types of STDs. Thank you.
The CDC reports that the following statistics from 2018 are their most current research on the prevalence of STDs. So the STDs that they have research on are chlamydia, gonorrhea, primary and secondary syphilis, congenital syphilis, HPV, and herpes simplex virus. So for chlamydia, Nevada has the 14th highest amount of cases nationwide at 584 cases per 100,000 residents. And since 2014, nationwide, actually, this has also had a 19% increase. So it's mainly found in females 20 to 24 years old. And so for gonorrhea, Nevada has the 12th highest amount of cases at 216 cases per 100,000 residents. So this has had a 63% increase nationwide since 2014 and is also found in those females 20 to 24 years old. So primary and secondary syphilis, Nevada actually has the highest amount of cases nationwide at 22.7 per 100,000 residents. So since 2014, though, this has had a nationwide increase of 71%, and it is actually found in males 20 to 24 years old, not females. So congenital syphilis, Nevada has the second highest amount of cases, 85.5 per 100,000 residents. And this has actually had an 185% increase nationwide since 2014. And HPV actually has a vaccine now, and it's available for 11 to 45-year-old women, and this has helped decrease the prevalence of this STD. And lastly, we have herpes simplex virus. That is one of the most prevalent sexually transmitted infections, and a contributing factor is increasingly common oral sex behavior among adolescents and young adults. So this is going to be not all of them, but just the main ones that are prevalent in America. And so individuals 15 to 24 acquire half of all of the new STDs, and 1 to 4 sexually active female adolescents have an STD. So that 15 to 24 age group, females, adolescents, that's going to be the age groups that we need to look at for primary prevention, because this is where we're seeing the problems. And so the higher prevalence of STDs among adolescents may also reflect multiple barriers to accessing the information about STDs prevention and management, inability to pay for this, and lack of transportation, long waiting times in clinics, conflict between clinic hours, work, school schedules, and also maybe embarrassment about speaking or seeking out treatment for STDs or prevention, the method of specimen collection, and also concerns about confidentiality, so worries about their peers or their parents finding out. So just once again, this primary prevention is important, just to let them know that this is STDs are not something to be messed with and that they need treatment as soon as possible.
Prevention of STDs. One of the ways to prevent STDs is to practice abstinence, so not having sex, any kind of oral, vaginal, or anal sex at all. Another recommendation is getting vaccinated. The HPV vaccine is recommended for preteens aged 11 to 12, all the way up until the age of 26 if they didn't get it earlier. Also, the hepatitis B vaccine is recommended if you haven't gotten it already. Another way to prevent STDs is to reduce the number of sex partners that you have or practice a monogamous relationship, so only having sex with one person. STD testing is very important, so know if you're infected or your partner or partners are infected. Adults and adolescents aged 13 to 64 should be tested at least once for HIV. Sexually active women younger than 25 should be tested for gonorrhea and chlamydia every year. Women older than 25 who have risk factors such as having new or multiple partners should be tested for STDs as well, such as gonorrhea and chlamydia every year. All pregnant women should be tested for syphilis, HIV, and hepatitis starting earlier in the pregnancy. This can protect the mom and baby, and testing should be repeated if the pregnant mom is practicing riskier behaviors. All sexually active gay and bisexual men should be tested at least once a year for syphilis, chlamydia, and gonorrhea. Those who have multiple partners should be tested even more frequently, so every 3 to 6 months. Sexually active gay and bisexual men may also benefit from getting HIV testing more frequently, so every 3 to 6 months. And also anyone who practices unsafe sex where they share drug equipment such as injection needles should be tested for HIV every year. It's also beneficial to know the low risk versus high risk behaviors for contracting STDs. Low risks include open mouth kissing, such as French kissing, or hand to genital contact. Higher risk behaviors include oral sex, such as genital or anal, vaginal intercourse, genital to genital contact, or the sharing of sex toys. Another way to prevent STDs is to avoid alcohol. So alcohol increases your risk of making a poorer decision and not practicing a safe sex. Also, the correct use of condoms is very important. So correct and consistent use. So using them all the time, every time you have anal, vaginal, or oral sex, and that is very effective in reducing the STD transmission. So with condoms, make sure you're using them correctly. Don't open the package with your teeth or scissors. Just gently tear it open, pull out the condom, roll the condom up over the head of the penis where it is hard, pinch the tip of the condom enough to leave 1/2 inch for the collection of the semen, and then holding the tip of the condom, roll it all the way down to the base of the penis. So don't keep the condoms in a place where it can get very hot or in direct sunlight. Don't use oil-based lubricants, which can kind of break the barrier and not make it as effective. And don't reuse condoms at all, or don't use them if they're expired or torn or anything like that. And then lastly, so it's very important to establish boundaries for yourself, for your partner. So have open communication with whomever you're having sex with.
Hi guys, I'm here to talk to you today a little bit about what to do if you do get an STD. The first thing you're going to need to do is go get tested from your doctor and get your treatment started. The most important thing with an STD is making sure you get treated and comply with the full medication regimen that your doctor prescribes for you. Many STDs are asymptomatic, meaning they have no symptoms, so you can have the disease but not show any signs and symptoms of having it. So just because you're not showing signs doesn't mean you don't have it. It's important to get treated to help stop the spread of disease. Getting treated also stops the disease from causing further issues and illnesses within your body. For example, untreated chlamydia or gonorrhea increases an individual's chance of getting HIV. And untreated STDs also cause further sexual organ illnesses, disease, infections. The second thing you need to do is tell your partner. You need to let your partner know that you had an STD and it's possible that they now have an STD. This is important, again, for the same reasons, stopping the spread of it, making sure they don't get any further health complications from it. A lot of times, if you go to the clinic for your STD and you think your partner might have it and you're unsure, if you bring your partner with you, they will test your partner as well as give the partner treatment through your write you a prescription for you and your partner, which is important and helpful, especially if your partner does not have insurance or the money. They do this to kind of help out to further the spread of the disease, as it is a community health issue. So eventually, if you're untreated, you have, your frequency increases, the state health board not health board, but the state health division will try to find you and get you treated so you can stop the spread, because it just causes more issues within the community when you don't get treated. And then the last thing you need to do if you do get an STD is you need to stay fully compliant with your medication regimen. If you think, you've completed your medication regimen that was prescribed by your doctor of antibiotics and you're still showing signs and symptoms, you need to go back to your doctor and let them know they might need to prescribe more antibiotics or new antibiotic. And then you also, even if you're not showing signs, symptoms after taking your medication, you need to get retested in 3 months just to make sure that you are clean and that you are not asymptomatic. and not showing signs of an STD. And then also have your partner get retested. This is just to double check and make sure both of you are clean to prevent, again, further illness and the spread of it. When you do get an STD, there's many places you can go. You can see your primary care provider, any urgent cares, any health clinics, the hospital, your OBGYN, any type of health service within the community or within the city where you live will be able to treat you for these illnesses.